So what are innovators expected to see when they go to the ground in Mexico to do needs finding and observations? If you divide the 120 million Mexicans that are there, 95% of them have access to public system and 5% have access to private system. The Mexican healthcare system was designed in 1943 as we know it today. So there was a huge investment back then that hasn't necessarily been updated. With universal healthcare coverage, the access for patients was increased, but not necessarily the infrastructure. So what you get to see if you go to a traditional IMSS clinic is old infrastructure, crowded. There are long waiting times. And then if you are a patient and you go through the process of receiving care, it's not easy to identify the steps or where you need to follow. In small towns, you would go and see a clinic in Seguro Popular within the system. There's the clinic. There's no instruments. There's the doctor, who usually is, in small populations, it's a recently grad doctor providing care without any surveillance and without any measurements. Most times they don't have medications, so you'll see a private pharmacy in front of the clinic. If one of these doctors wants to make a referral to a city hospital, most of the times it will just be a piece of paper and send the patient and have the patient navigate the context. And if they reach to the urban city, most of the times what you'll see in urban hospitals like Seguro Popular or even IMSS are big hospitals with a lot of infrastructure, with a lot of technology, but the system's being totally overwhelmed and having patients accessing the system based on connections. So you'll see a lot of doctors offering you to be treated outside the clinics, the physical facilities on their private clinic, because they just know that the patients will be able to afford because they want to receive care. So we were in northern Mexico in a small town near Monterrey, and we were doing observations on primary care clinics, on rural primary care clinics. We were sitting in the waiting room, and all of a sudden there's this baby boy that comes into the clinic with an asthma attack. We see the doctor bringing out not an inhaler and not a nebulizer. He brings out his private room humidifier because it's a very arid area in town. So it's a regular off-the-shelf humidifier that you can buy anywhere. He would pour the medication into the reservoir, the water reservoir of the humidifier, and then put the baby's face in front of the humidifier and then a towel on top so that it would try to contain whatever vapor was coming out over there. And we just kept observing and said, why would he do that? And asked him, don't you have a nebulizer? And he happened to have a nebulizer, which was broken. Since when has it been broken? Years, since he got there to work. So he had never used it. And then we asked him, so what else would you do? And he brings out a bottle of Coke, an empty bottle of plastic, a soda plastic bottle. He would chop the bottom off and use that as a mask. And then the mouthpiece of the bottle would be the place where the nebulizer would be inserted. And then he would put the empty bottle of Coke, which is basically trash, into the baby's face and use it as a spacer. So just by asking, we were saying, wow, there's something here that it just feels that we need to follow, because he's trying to be innovative, providing care in many ways with the resources that he has, and he's providing care. What's the quality of care? That's a different question. But we said, okay, let's follow this. And that turned to be Respira, which was a paper-made spacer, origami-like type of structure that would allow, at a fraction of the cost of a regular spacer, provide that care.